All right. So Kirk Larson is here with the Social Security Administration. We're really grateful to have him. And I'm going to stop sharing my screen and turn it over to him. Kirk, the floor is yours.
Thank you, Anthony, and welcome everybody to today's presentation. My name is Kirk Larson, and I do work for the Social Security Administration. Give you a little background on myself. I've actually worked for Social Security for over 30 years, so I've done a little bit of everything for them. Let me just step out here. I'm trying to share my screen and it says send a request to presenter. So I'm not set up as a presenter, I don't believe.
Oh, you are set up as a presenter. I don't know why you're asking, but this has been acting really, really weird. Can you just send it to me? Yeah, I have it right now. So good. You should be able to
Yep.
take the screen right now. You're good.
All right. Well, let's go ahead and open this up here. So I've worked for Social Security for over 30 years, done a little bit of everything for them. Worked in offices in California and in Washington State. Worked in our disability branch, our quality control, our 800 number. So I have lots of information that I want to share with you today about Social Security. Now, in today's presentation, we are going to be focusing on disability benefits. So this is really where we're going to be focusing our time. Although in our question and answer period, if you want to ask other questions, happy to go ahead and address anything that you want to bring up. So we're going to start off with kind of a little bit of an overview about Social Security's different disability programs. We administrate two different programs. One of them is Social Security Disability Insurance, and the other one is Supplemental Security Income, or SSI. We'll talk about how we define disability. What does Social Security consider when we say somebody is disabled or not disabled? We'll talk about the concept of substantial gainful activity and how that plays into our disability determination. And then we're going to look at some of the different eligibility requirements for these two programs, talk very briefly about Medicare, and then have some information on our online services. But since our online services have actually become more and more important, I'm actually going to go ahead and switch it up a little bit and start off with a discussion about online services. More and more of what Social Security is doing is going online, and we're trying to allow clients to have access to be able to work with their records, do things online, file online, and control their records online. So if you want to understand your Social Security benefits, and yes, someday you will all be clients of Social Security. If you want to understand your personal benefits, you need to open up your individualized My Social Security account. Or if you're working with somebody that wants to understand their benefits, they need to open up their individual accounts as well. Today, we have over 100 million people that have opened up their individual My Social Security accounts. So hopefully you're one of those. If you're not, hopefully after this presentation, you'll go ahead and open up your account. If you're not on benefits, it becomes a great planning tool to help you understand what your future benefits will be. You can view future retirement benefits. You can view possible spousal benefits. If you have this online account and you need a replacement Social Security card, you can request it anytime you need it. You can also check the status of your application or appeal directly online. And most importantly, you can pull up your Social Security statement, which will show your future retirement benefits, disability benefits, survivor's benefits, and it'll allow you to review your work history year by year, which is something we encourage people to do. You want to be sure that you're getting credit for all the work that you've done. Now, if you're on benefits, this becomes even more important. You can now control a number of different things that go on with your benefits. If you want to opt out of getting mailed notices, you can do so and get everything directly online. Once again, if you need to request a replacement Social Security card, you can do that right from the comfort of your own home. If you're on one of our disability programs, you can report your work activities if you've returned to work. Or if you're on our SSI program and you're working as a parent or as a spouse, and you have somebody else that's on a disability program, you can report your work activities there. You can also get a benefit verification letter proving how much you're getting from Social Security. You can check your benefit and payment information and your earnings record to confirm that everything is correct. So not only can you report things, but you can see how things were reported in the past. You can also change your address, change your phone number, change your direct deposit. And you can also submit an advanced designation of representative payee. Now then, probably most of you know this, but Social Security does not utilize power of attorney documents. So if someone's become incapacitated, we cannot assist somebody that says that they have a power of attorney document. We need to appoint someone to be the representative payee and manage a person's record that can no longer manage it for themselves. With this online account, you can designate up to 3 different people that you would prefer to be your representative payee in case something happens. You can also request a replacement Medicare card right online or replacement tax documents. So great opportunity to control your Social Security benefits, control your record, do things directly online so you don't have to go into an office or you don't have to call us. Now then, let's go ahead and jump in to talk about disability benefits. And I want to start off with a quick compare and contrast between the 2 different programs. A lot of people that are on our disability programs really merge the 2 programs. They use these terms interchangeably. I'm on Social Security disability. I'm on SSI. I get disability. They use these terms interchangeably, but really they are 2 very different programs. So regular Social Security disability insurance, payments come from Social Security trust funds and are based on a person's earnings. So you could get anywhere from $300 a month all the way up to $4,000 per month under the regular Social Security disability insurance program. SSI, on the other hand, payments come from general treasury funds, not the Social Security trust funds. SSI payments are not based on a person's earnings. And under that program, you can get anywhere from $1 all the way up to $994 per month. Regular Social Security disability insurance that workers earn by paying Social Security taxes on their wages. You need to have worked and paid into the program. SSI, on the other hand, is a needs-based program where eligibility depends largely on having limited income and limited resources. Regular Social Security disability insurance pays benefits to people who can no longer work due to a disability, regardless of their income and resources. We don't care if you have $1 million. If you've worked and paid into the program, you can file for the benefits. SSI, on the other hand, pays people with a disability who are unable to work and have limited income and resources. Pays aged individuals, 65 and older, with limited income and resources. And finally, for the regular Social Security disability insurance, pays benefits for workers and adult children with a disability since childhood, must meet insured status requirements. I'll talk a little bit about that later on, but in order to qualify for Social Security disability insurance, not only do you need to have worked, but generally you need to have recent work. Meaning generally for someone that's over the age of 31, we're going to look backwards 10 years. And in that 10-year period, you have to have the equivalent of 5 years worth of work. Now, we're not talking about a lot of money there. A year's worth of work for our purposes is about $8,000 in wages or self-employment. But in order to be eligible for that program, you need to have that recent work. If you're under 31, we'll talk about that a little bit later on. SSI, on the other hand, pays benefits for children and adults in financial need, must have limited income and limited resources. Of course, if you're a child, and we'll go into that a little bit later on as well, we're not just looking at the child's income, but we're also looking at their parents' incomes if they're living with their parents. All right, so I'm going to start off with talking about the definition of what we consider an individual to be disabled if they're an adult. So this is someone between the ages of 18 and 67. So in order to be considered disabled, this is what we look at. This is our brief definition of disability. That is a person who cannot work due to a severe medical condition that could be mental or physical that has lasted or is expected to last at least 1 year or result in death before the end of the 1 year period. The person's medical condition must prevent them from doing substantial gainful employment. So this is where this concept of substantial gainful employment comes in, or substantial gainful wages. What we're looking at here is, in order to be considered disabled, real brief what we do. Our doctors get your medical records, and they look at everything that limits your ability to work, right down to the fact that you wear glasses, because that is a limitation in some jobs. So they look at your ability to work. They look at your vocational history. What type of work have you generally done in the last 5 years? So we get those medical records, we get your vocational background, we get your educational background, and then they determine, could you return to work, any kind of work, any kind of job, and make $1,690 per month? If the answer is yes, even with your limitations, there are still jobs available out there where you could make $1,690 a month, and you are physically capable of doing them, then you are not disabled for Social Security purposes. Doesn't matter if you were making $5,000 a month before your injury. What they're looking at now is, can you make $1,690? And if the answer is yes, then you're not disabled. If the answer is no, then you can go ahead and qualify for disability benefits. Also like to point out here, you do not need to stop work in order to file for disability. If you are still working and you have a disability, let's say you're making $1,200 a month someplace, well, you're under $1,690, you can go ahead and file and still keep on working and making that $1,200, for example. You can still file for benefits, and it will not alter our decision if you are disabled or not. Now then, the $1,200 wage payment that you're receiving would lower what you'll get from the SSI program, as we'll see here later on. But the fact that you're working does not mean that you're not disabled. And since you're making under the statutory $1,690, you can still move forward with our decision if you are disabled or not. Also like to point out that if you're blind, the dollar amount that we're looking at is, are you capable of making over the $2,830 or not? All right, I've thrown a lot of information at you, and I've seen some possible questions that have come in. Do we have any questions that have come in so far?
You sure do have questions, Kirk.
All right.
Okay, so we've got, can you explain the certain requirements for a replacement Social Security card? I applied via my online account in February. No card received thus far.
Then there's a problem. If you went online, requested a replacement card, you should have had it within 2 to 4 weeks. So at that point, there is a problem. If you have an online account, it should have normally gone through. I would request another card. If you don't have it in 2 to 4 weeks, then you're going to need to contact us at our National 800 number. Now, I assume you were just asking for a replacement card. You are not making any changes. If you're making changes to the record, you want to update your name, generally you can complete the application online, but you're going to need to go into the office to complete the change. If you're updating your name or citizenship status or something like that, you can complete the application online, but you're going to still need to go in and show us the documents that this change is based on.
Okay. Next question. Is it true Social Security cards are going digital?
Yes, they're not all going digital. They're going to still be paper cards that will be coming out. You can still get that option, but they're also talking about a online card that you can use for employment purposes. So we already have done something like this for a number of years. It's just kind of a different concept. Generally, for the last roughly 15, 20 years, we've allowed employers to not request your Social Security card, but to use our program called the SAVE program, which allows an employer to go in and verify information. Meaning, if you tell your employer your name, date of birth, Social Security number, they can go online to our website if they've registered for this type of activity and basically feed that into the computer. And if it all comes back the same, they don't need to see your Social Security card. They can assume that the information is correct. So we've already had something like this, but now we're just going to have more of a digital card that someone could actually do that, and then they'd be able to see the information. It's a very, very, very subtle change in that respect, but employers have already been able to do this and verify your information for a number of years.
Okay, next question. Is there a specific clinic the client has to go to complete the paperwork? I do have a newborn who needs to be in a medical setting, so can the baby eligible for SSDI for the baby to be eligible for SSDI benefits? The parent has no home to take the baby and they are low income.
So generally, if the child is in the hospital would help complete the paperwork. Anybody can do the paperwork. So if you have a caseworker at the hospital, they want to help you fill it out, that's fine. If the parent wants to fill it out, that's fine. But there is no prescribed individual that needs to fill out the application. That can be done by almost anybody. Now then, where we'll get the medical evidence from to substantiate the allegations, that's different. We're going to need to get it from the medical provider in those situations. So almost anybody can complete the application. If the mother's not capable, or the mother or father's not capable of doing it, they can ask the social worker at the hospital to help them with it. They can call us. We'll help them complete the information. But the reality is that they're going to need to be able to provide us information. If we say, where's the medical evidence? They need to give us a good address. They need to give us good dates on when this medical evidence would have been in existence so we can request it. If they're getting it under some sort of a medical number or provider number, we'll need that information. Where people, unfortunately, tend to shoot themselves in the foot trying to set up an application is they come to our applications, they schedule an appointment and then they show up with no information. Generally, if someone schedules an appointment, we're going to send them a starter kit that basically details what type of information they're going to need. If you're an adult, there's an adult starter kit. If you're a child, we'll send your parents or guardian the starter kit on what information we're going to need. But when you show up for an appointment and you just don't have any information that you can provide us, the reality is you're just increasing your odds that you're going to get denied because we're not going to be able to find the information that we need. I hope that answered the question.
Okay. And there's a comment in the chat. My experience has been that for people with SSDI, the website does not allow you to submit your pay stubs.
So you will not actually submit the pay stubs. You're talking about going in and entering the information. Of course, you have to, if you should be able to. I'm not sure why it would, particularly for someone on regular Social Security disability insurance. I'm not sure why that limitation would be there or why that's been your experience, but it's set up to go ahead and do so. Now then, remember, that's for ongoing employment. Of course, if you have a new employer, you're going to have to go ahead and set that up with the office. But once you've established it with the office the first time, if you have this online account, you should be able to submit the information directly online.
Okay, and I think those are the only questions related to Social Security right now, Kirk.
Sounds good. All right, so we'll go on and we'll see if more questions pop up. So common question I get, when should I apply for disability benefits? And I tell people, as soon as you believe you meet that definition, that you are going to be unable to work for the next year and make that $1,690. File for disability. Go ahead and you can either do it online, which I think is the best way to go ahead and do it. And the reason I think it's the best way to do it is because you have time to put the information in. If you get scheduled for an appointment at an office, we have about an hour and a half to get it done. We will be done with it in an hour and a half because we have someone behind you that's also filing for benefits. So if you are not somebody that can come prepared with all the information that we're going to need, doing it online is nice because if you want to take a day, a week, a month to fill out the paperwork, you can do that. So, but you can also file the application with us when you get an appointment. So as soon as you believe you meet that definition, file for disability. Processing an application currently takes about 6 to 8 months to get a decision. Doesn't necessarily mean that's an approval. Generally here in the state of Washington, for people that are filing for the first time, we have an allowance rate of close to about 40%. So it's not true that we deny everybody. You hear that we deny everybody because the people that got denied say they got denied. The people that got approved, they go away, they're happy. They don't come back and say, hey, I was approved. So we do approve a number of people at the initial claims level. We may be able to process your application faster if you help us by getting any information that you might have. So any medical records you can provide us at the time that you're filing is helpful. It'll allow us to speed it up. Often a long part of this 6 to 8 months is simply waiting for medical records to come in from your doctors. We have no control over how or when your doctors will send us the materials that we need. So if you can provide us something at the time of the interview, that allows our doctors to get started quicker. Like I said, you can file for benefits directly online. Probably the best way to go ahead and do it. But if you do want to do an interview with somebody, you can call our national 800 number and they can go ahead and schedule an appointment to do the interview. Generally, you will not need to go into the office. Generally, you can go ahead and do that interview by phone. What happens next? Your application will be reviewed to make sure you meet the basic requirements for disability. We'll check whether you worked enough years to qualify and evaluate any current work activities. So when you file, if you're filing for regular Social Security disability benefits, we're going to say, do you have enough years worth of work? If you're currently working, are you making over the $1,690? We'll look at that. If you're filing for our needs-based program, we're going to ask you a number of financial questions. A lot of people don't like that. A lot of people are saying, I'm here to file for disability, and we're asking them about their bank accounts, things that they own, different questions like that. But that is part of the needs-based application. If here we discover that you don't qualify for benefits, we're going to deny your claim right there. We're not going to send it to our doctors for a medical evaluation. You could be 100% disabled, but if you don't meet these requirements, enough work for Social Security disability, if you're working over the allowable limit, over the $1,690 currently, if you're filing for our needs-based program and your income and assets won't allow you to qualify, we're going to make the decision right there. We'll deny your claim. And we won't submit it for a medical evaluation. If you meet the requirements, then we'll go ahead and forward it to the Disability Determination Service Office. The Disability Determination Service Office, or DDS, this is a state agency. They don't work directly for Social Security, although their funding comes from us, but they don't work directly for us. They're actually all state employees. The doctors and disability specialists at the state agency ask your doctors for information about your condition. They'll consider all the facts in your case. They'll use the medical evidence from your doctors, hospitals, clinic, institutions, schools, wherever you might have any records that indicate what your medical condition is. We'll use that information to make the decision. So you are once again in control of this. If you have 10 doctors and you want to give us 3 of your doctors, you can go ahead and do that. You're, of course, increasing the likelihood that you'll be denied, but if you don't want to give us all your medical information, that is your choice. we do encourage people to tell us everything that limits your ability to work. You know, if your major condition is that you have a back injury, but you also have an old knee injury, but you don't really think about that as being a disabling condition, you should still tell us about it. Wearing glasses, your vision's not what it used to be. Anything that limits your ability to work, you want to include that in your application. When it gets to our doctors at the Disability Determination Service Center, they go ahead and go through a 5-step process to see if you're disabled. Number one, they look at, are you working now? If you are working, are you making over the $1,690? If the answer is no, you move to the next step. Is your medical condition severe? Do you have a condition that will last a year or more? So if you showed up and you had a broken arm, two broken arms, two broken legs, yes, you are disabled now, but will that be limiting you 12 months from now? So they're going to look at do you have a severe condition that's going to last for a year or more? The answer is yes. They move on to it. Does your impairment meet or medically equal the listings? The listings is something called the Blue Book. You can look this up online, Social Security Blue Book. Basically, it's a giant book of terrible, horrible things that can happen to the human body. And in that book, if you have one item that you meet all the requirements, all the listings in, we can approve you right there. We don't have to go forward and look at your work history. Now, then, these are usually very severe conditions, you know, advanced Parkinson's disease, amputation of a limb, some other organic mental disorder, different things along those lines. Only about 25% of people get approved at that particular level. Most people, we have to look at the totality of all your disabling conditions, all the many different things that might limit your ability to work. So generally, some people do get approved at that level, many people do not, and we have to go to step number 4. Can you do the work you did before? Can you return to the job that you've done in the last 5 years and make $1,690? If the answer is no, you can't, then we go to step number 5. Can you do any other type of work that you're qualified for? So we're not saying that, hey, you could go be a doctor if you have no medical training. We're going to look at, do you have any transferable skills? Or could you go to a low-skill job and make $1,690? If the answer is no, you couldn't, then you're approved for benefits. We do have a special process called the Compassionate Allowance or CAL decisions. Basically, if you in your application indicate that you have a severe condition, and you'll see this URL code down here, Compassionate Allowances. There's roughly about 250 medical conditions that we can allow you almost automatically. If in your application you allege one of these medical conditions, when we send it to our doctors, the form is scanned, and if our AI picks up these words, you know, metastatic breast cancer, advanced Huntington's disease, ALS, or what's better known as Lou Gehrig's disease. If you're alleging these things, basically the computer will then move it to a different group of doctors who can make a quicker decision. Usually we are able to make a decision on these cases in about 4 to 6 weeks, as opposed to the 6 to 8 months. So if you have one of these conditions, we can usually move it along very quickly. Also, if you are a wounded warrior or a veteran, with 100% permanent or total disability rating from the VA, we can move your case faster. Usually we'll be able to get all your medical records electronically. We don't need to wait for a mail to come in with your medical records. We can get information directly from the VA, directly from the Department of Defense, and we basically move veterans to the front of the line. We will try to speed up and make the decision faster in their cases. There's no special payments. There's no special benefit that they receive. It's just that we are able to move their cases along faster. We'll tell you our decision. When the state agency makes its determination on your case, we'll send you a letter. If you're approved, the letter will show you the amount of your benefit, when your payments start, and your reporting responsibilities. Very important. Everybody gets reporting responsibilities on what they need to report to us if they do something. You might have gotten that 10 years ago when you first became disabled, but you received them. Hopefully you kept them, or before you do certain things, you're going to check in to see if that will have an effect on your monthly payments. If you're not approved, the letter will explain why and tell you how to file an appeal. I always encourage my clients that if you got denied and you still feel that you are unable to work and make the $1,690 monthly wage or above, file the appeal. If there's no harm in filing the appeal, you want to get that done as soon as possible, but generally you have 60 days to get the information in. Also, if you have any new and material evidence, remember, you may have filed for benefits 6 to 8 months ago. If during that time you had some new and material evidence, you saw a new doctor, your condition got worse, something else happened that made you disabled, get that information into us. Include that in the appeals package. All right, before we jump in to talk specifically about some special items with regular Social Security disability insurance, any questions?
You've got several. Okay. And a couple of these I believe you've answered through your presentation, but I'll go ahead and ask them anyways. So what criteria do you need to meet to qualify for disability?
I've basically gone over that. We're going to look at your vocational background in the last 5 years. What type of work have you done? And then we're going to look at your medical records. We're going to get the information that shows what your disability is, what your limitations are, and then our doctors will determine, can you return to work? In this area, Western Washington, King, Pierce, Snohomish County, there are lots of different types of jobs that people might be able to do. This is one of the more difficult areas in Washington to qualify for benefits because there are many different types of jobs, many different types of skill levels. And so that creates the more likelihood that you'll be denied benefits, as opposed to living in Pacific County, for example, where there's very few jobs. I think they have the highest unemployment in the state, or lowest number of people in a county working. You're more likely. The reality is you're more likely to be approved for benefits. So some of this has to do with geography. It also has to do with the economy in your area. Remember, when we're looking at, can you make $1,690? When you're living in an area where minimum wage is $20 plus an hour, it's a lot easier to hit $1,690 compared to living in, let's say, Texas or Mississippi, where I think minimum wage is around $11 or $12 an hour. So it's a lot harder to hit $1,690. So geography and where you live does play a picture into these determinations as well.
Okay. Next question, and I believe you answered this, but the person wrote $1,600 per month or every 2 weeks?
When you say so it's $1,690 a month is the limit that we look at. Are you able to make that in a 30-day calendar period?
Okay. And next question. If there was a mistake with the amount someone is receiving from SSDI and was told it's supposed to be higher due to the level of disability of the member, what is the process to inquire about reevaluation or adjustment?
There is no such thing. I've actually heard this, that that's kind of a myth that we pay you on some sort of sliding scale. With Social Security disability, it's all or nothing. So if you're talking about Social Security disability insurance, not the SSI program, but Social Security disability insurance, it's an all or nothing. If you're disabled, you're disabled. If you're not disabled, you're not disabled. And there is no sliding scale. We basically pay you 100% or 0%. in those types of situations. So if you disagree with the amount that you're receiving, that amount is based on your work record. If you disagree with your work record, you say you're missing something. I know I worked at XYZ company and it's not showing up on my list as me working there. That would be the challenge that you'd make. And you say, I think I should be getting more. If you want to challenge the date that we decided you filed for, you were approved. Let's say you said I became disabled in January of 2025, and we say no, you didn't become disabled until July of 2026. You can challenge that. You're still been approved. We're going to pay you benefits, but you can still file an appeal as to the date that we found that you were disabled as well, even though we've already approved you and we're going to start paying you money. If you want to file a separate appeal on the date, you can do that as well. But no, it's a myth that we're not paying, that somehow we're not paying you the correct amount. In those situations with regular Social Security disability insurance, it's an all or nothing. SSI, it is kind of a scale. If you have other incomes coming in, that potentially will lower what you get from the SSI program. And you can challenge that. If you disagree, if you say, you're lowering my benefit because you believe I'm getting free rent. Here's why. Here's the proof that I'm not getting free rent. That type of thing. You can challenge that decision, and we could potentially increase the amount of payment that we're giving you.
Okay. Next question. I have a client that is awaiting a court hearing date for their claim. One of their medical conditions has been significantly worse, and when we tried to see if Social Security has one of their doctors do a physical exam and was told that this was not an option. Is this correct?
At that time, if you're waiting for the hearing, that's correct. We're not going to pay for one of our doctors to do a medical evaluation. That can be done at the first and second level, or at the court hearing. If the doctor looks at that and says, you're right, you need to have a medical evaluation, they can return it to the DDS and say, have this person done, have a medical evaluation paid for. But if you're at the hearings level, we're not going, unless the judge orders it, and then what we call a remand, they return the case down to the lower level for them to reevaluate it. We're not going to pay for you to have a medical exam. Now, if you want to come forward and say, I have new medical evidence, I did get a medical exam, I've been to a doctor, and this is what they say, they discovered something new. They thought it was a back injury, but actually I have a tumor. That's a cancerous growth. That would be evidence that you could then supply to the judge, and they can take that into account and either themselves find that you're disabled or return the case down to the lower level for them to do a medical evaluation.
Okay. Next question. I've got 4 questions. Can the client apply for both SSI and SSDI?
Absolutely.
Is it the same application?
Yes. There is an extra application if you're filing. There are 2 separate forms if you're filing for Social Security disability and the SSI program. One is called an SSA 16 and one's called an SSA 8001. But the medical form that you complete is the exact same one. And we would take the exact same information to make the medical decision. Because the Social Security disability insurance and SSI program, they both use that same medical definition of disabled. So the form where we gather your medical evidence is the same, but there are 2 separate forms that you would complete, one for Social Security disability insurance and one for the SSI.
Okay. Next question. If a woman receiving SSI after her husband passed away and she is disabled but never worked, can she apply for SSI for herself and continue receiving her husband's SSI as well?
Okay, so this is a good example here of the confusing of the terms. SSI, remember, is a needs-based program. So you can't receive somebody else's SSI. Remember, SSI is our needs-based program. So this is a great example of where people confuse the terms between the programs. Social Security disability insurance is based on work. Survivor's benefits, if someone's passed away, you potentially can receive survivor's benefits. If you are disabled at age 50 and you can file for survivor's benefits. If you reach age 60, you don't have to be disabled because of your age. You could file for survivor's benefits. SSI does not have a survivor's program. It's a needs-based benefit. So it's not one that you've earned. So you can't inherit somebody else's SSI in that case. So I think the person is confusing the terms here. And I'm not sure what they're trying to get at here. But yes, if you were getting some sort of survivor's benefits or retirement benefit, and it was under the $996 a month, let's say you were getting a $800 survivor check because your spouse had passed away, and you want to file for disability. So let's say you're 60 years old, you're getting $800 a month as a survivor, but you're also disabled. You could then also file for the SSI program, and it would bring you up to the $996 a month. So you'd get $800 from one program and $196 from the SSI needs-based program, for example.
Okay. And then following up with this one, are there survivor benefits for SSDI? Or I'm thinking that maybe there's confusion between SSI, SSDI, and just regular SSA.
So when you work and pay into Social Security, you're actually investing in a few different types of benefits. When you're working and paying into Social Security, you're paying into a retirement program, so Social Security retirement. So if you reach a certain age, you can retire and receive a certain income. If you're also at the same time paying into a disability program, you're basically buying disability insurance when you work and pay into Social Security. And if you become disabled, you can file for that benefit as early as age 18 if you wanted to. And if you're disabled, you could qualify for a monthly payment. Also, when you're working and paying into Social Security, you're also buying life insurance. So if you pass away and you have surviving children, minor children, surviving disabled children, or surviving spouse, they will be able to receive money off of your record. So when you're working and paying into Social Security, it's not just about retirement. It's not just about disability. It's also about creating a life insurance program, a survivor's benefit that your children might qualify for or your spouse might qualify for. SSI, on the other hand, is an independent program that is based on need. You may never have worked, and you might be able to qualify for that program. And the two things they look at for that program, are you disabled or are you 65 or older? And that program you could then qualify for. I hope that clears that up some.
Okay, so and then in the chat, the worker added, can she apply for SSI for herself?
Yes, but SSI will only pay the maximum of $996. And so if she's already getting more in survivor's benefits, if she's getting $1,000 in survivor's benefits, there is no SSI to apply for. So it depends on how much she's getting as a survivor's benefit.
Okay, a couple more questions here. They're just coming in as we're talking. Can a person have L&I and receive disability insurance?
Yes, but they will offset each other. So you can't get SSI, our needs-based program, because you're getting L&I. So you're getting monies from a disabling condition that you've been approved for, a work-related condition. So let's say you're getting $1,500 from from L&I, Labor and Industries, Workers' Comp. You're already getting over $1,000 in that program, so you can't file for our needs-based program, but you could file for Social Security disability insurance. However, those two programs have agreements that they will begin to offset each other if you get to a certain level. meaning that if you were going to get 1,500 from L&I and 1,500 from Social Security, they have a max. They'll say between the two programs, the most you can get is $2,800. So one of those two programs gets to lower what they pay. Sometimes it's Social Security gets to lower their amount. So we would just say we're only going to pay $1,300 a month. And sometimes L&I gets to lower what they pay. And Social Security would pay the $1,500 and L&I can pay the $1,300. So yes, you can still file for both, but they will begin to offset each other.
Okay. And just a quick comment, having been a financial worker with DSHS, I think with L&I, if you're getting L&I money, you're stating that you are physically able to work. So if you're physically able to work and you're getting L&I money, then I would think that you wouldn't be eligible for SSI when you're stating
Well,
that you have a disability and you can't work.
You wouldn't be eligible for SSI, our needs-based program, because you're getting too much money. For Social Security, remember, you can be on Social Security and still work. You can, as long as you're making under the $1,690, you could qualify for that. So yes, theoretically, this gets to be interesting. You could be getting $1,500 from L&I. You could be getting $1,300 then from Social Security disability, and you could still be working. And as long as you're making under the $1,690, we won't stop your benefits. So you could be working, getting a wage of $1,500 a month, getting a Social Security check of $1,300 a month, and getting L&I benefits of $1,500 a month. And you'll be able to do that for the rest of your life. And we would not stop benefits unless you medically recovered.
So in a nutshell, apply for everything and see what you get.
That's right. No, throw that spaghetti at the wall and see what sticks.
Okay. Question. How about a client who is receiving a pension? Can they also apply for SSDI if they previously contributed to Social Security through their work history?
Absolutely. If you're getting a pension, veterans benefits, you can file for both programs.
Okay, next question. How do you go about challenging the current amount being received in order to get an increase from SSI? I think you already answered this, but go for it.
So from SSI, remember, and I'll just jump ahead here real quick. SSI pays a maximum of $994 this year. It can be lowered for a number of different reasons. And actually, I'll kind of segue into this to answer that question, and then we'll come back to some more questions. But I'll cover some of this material right here because it's kind of an excellent entry into this. SSI, our needs-based benefit, pays an individual a maximum of $994. Pays a disabled couple $1,491. When we evaluate this to see how much are you going to get the $994 or not, there's a number of factors we look at. Income is number one. If you have any other income, that will lower what you're going to get from the SSI program. Now then, there are some protected incomes. If you're getting food assistance, for example, we won't count that. If you're getting energy assistance under certain programs, we won't count that. Note, these aren't cash programs. But if your most cash benefits or direct assistance that you're receiving might lower this program. Depends on where they're coming from. Generally, if it's coming from another government-based agency, it's not going to affect you. But if you're working, so here are the two different types of incomes we have. Earned income. So if you have wages, net earnings from self-employment, payment for services in a sheltered workshop, those are called earned income. Basically, you're performing some sort of work or service to get the payments that you're receiving. The reason we like to break this down, earned income, we only treat at the 50% level. So if you're on the SSI program and you're getting $994 a month, and you then go get a job and you're making $800 a month at that job, we will lower the $994 by about 50% of that $800, roughly $400. So you're still coming out ahead. You're getting $800 from the job you're doing. and you'll still get payments from the SSI program. You won't get $994. It'll be roughly reduce that by about $400, $594 per month. Unearned income, which is all other monies other than earned, SSA benefits, veterans benefits, unemployment, interest from in monies that you have invested, pensions, dividends, cash from friends or family, that is considered to be unearned income. And that will lower the SSI payment dollar for dollar. So if your friends and family are giving you $100, it will lower your SSI by about $100. If you get veterans benefits of $800 per month, you can file for the needs-based program, and it would lower it by $800 roughly. Now then, if you were filing for regular Social Security disability because you've worked and paid into the system, those don't offset each other. You can get both. Remember, this is our needs-based program that we're looking at, SSI. And then we have resources. If you're on our needs, well, so I'll need to finish up with this question and answer that one question the person had asked. If you're challenging the payment that you're getting, you're saying, I'm on SSI, I'm not getting $994 because Social Security says I have some sort of income. Not sure what income it is. Could be earned income, could be unearned income, could be a situation where they're getting free shelter, which is also potentially will lower what they get from the SSI program by as much as a third. If you're living someplace and you're living at your parents and they're not charging you rent, we would lower the $994 by 33%, one third. We don't care where you're living. You could be living in a mansion, eating lobster and caviar every day, but the most that we would lower it by is one third. So you'd get roughly $330 less. If you want to challenge that, you can say, I'm not getting the money you're saying that I'm getting. I can prove that I'm paying rent. Different things like that. All you do is you call the National 800 number, schedule an appointment with your office, and then provide the proof of why you think that you should be getting more money. Let me touch on one more thing here, and then I'll take some questions. Resources. So this is our SSI, our needs-based program. The other thing that can cause you to not be eligible for this program is your resources. Note down here at the bottom, as an individual, you're allowed to have $2,000 in resources. As a married couple filing jointly, you're allowed to have $3,000. So resources that we're going to look at. We want to know what's in your bank account. Do you have CDs, IRAs, money in a checking or savings account? Do you own any stocks, bonds, 401ks? Do you have any liquid assets? Do you hold anything for investment purposes? We're going to look at the second vehicle that you own or second form of transportation. Note, we'll exclude one form of transportation. That could be a car, that could be a boat, that could be a motorcycle, that could be a snowmobile, that could be a horse. We'll exclude one of them. Any other forms of transportation, we're going to count as a potential resource. So if you own a motorcycle and a car, you can exclude one of them. The other one we're going to count as a resource. And if we look it up and it's, let's say it's worth $1,000, that's $1,000 towards your $2,000. If you also then had $1,500 in a bank account, you're not eligible for the SSI program. Life insurance. Do you have any life insurance that has a cash value? Money that we can take out of it without you dying. And property other than where you live. So we'll exclude the home that you're living in. Once again, we don't care if it's a mansion. We'll exclude it. You own a $2 million home, that's great. We're not going to go ahead and consider that to be a resource. However, the property that you don't live in, that becomes a resource. Theoretically, you could sell it and still have some place to live. So that becomes a resource. Does that have a value? So things we exclude, the home you're living in, the first car, burial plots for self or family, and some resources set aside for burial purposes worth up to $1,500. Everything else we could potentially consider to be a resource. Now that if you have monies in an ABLE account, which is a special account for disabled individuals. If you have money in the ABLE account, those funds do not count towards the 2,000. Most other funds and bank accounts will. If you have monies that are tied up in a trust and you have absolutely no ability or control over how much money is in the trust or how much money comes out of the trust or what it goes to, once again, we don't count that as a resource because you have no control over it. All right, any questions about SSI income or SSI resources or anything else that we've covered so far?
I've got a few questions here. Is there any truth to the news about SSA insolvency in 2032?
It's actually a 2034. 2032 is where the retirement program would run into trouble. But we've moved money around before. So if you move money from the disability program and the survivors program and put everybody into one basket, it's about 2034 that all three programs, retirement, survivors, disability, would have a reduction. The reduction would be about 20%. So come the year 2034, everybody receiving a type of Social Security benefit would take a 20% cut to their benefits. That is the current plan. That is what we are working on right now. That's the only plan because Congress has to pass another plan. Social Security only has one option on the table where we can go ahead and automatically reduce benefits. This is kind of an interesting history lesson. This was written into the law in 1935 when Social Security was created. They knew that we might arrive at a date where the program would not be self-sufficient. And so they actually, if you read the Social Security legislation, Social Security is not required to pay anything. We're authorized to take the money in. We are not required to pay any money out. So it's within Social Security's control to cut benefits as needed based on the amount of money flowing into the program. So come the year 2034, our investments that we have, when we roughly have about $2.5 trillion, which we are rapidly using up, that'll be gone. And by 2034, we would have to cut everybody's benefits by about 20%.
Okay, a couple more questions here. I'm grabbing questions from the chat and from the Q&A. So bear with me here. I have a mother who reports she isn't able to access information for her son's SSDA because she does not have a social security number. Is this correct?
She doesn't have her son's social security number, so she can't access information for his disability benefits.
Yep. And then I think this same person may have reworded the question. I have a mother who reports she cannot access her son's SSDI information when she calls because she does not have a social security number herself. Is this accurate?
She doesn't have a social security, so she's not the representative payee. So she must not be getting the benefits for this child. So yeah, if she doesn't have the social security number for her own child and she's not getting the social security benefits and she does not have a social security number herself, it's pretty difficult to identify who she is. So if I just called up and had a random child and said, I'm the father, but I don't have the kid's social security number and I don't have a social security number, but I want you to give me information, it's probably not going to happen. There's a lot of barriers there that the person would need to overcome to be able to get information about what the child is receiving.
Okay. Can you collect DAC, disabled adult children, money from both parents or only the one that is paid the highest?
Generally, it's the one that pays the highest. If there are multiple children involved, minor children and disabled children, or just disabled children, or just minor children, there are times where we combine the two records of the parents. But generally, you have to have multiple children involved. If it's just one child, then they're going to simply file on the record of the higher parent.
Okay. Question, in regards to Social Security and Washington residency requirements, if you're a snowbird or say you're going out of state for maybe 2 to 6 months, does this need to be reported to the Social Security office?
No, if you're staying, so if you're getting your mail sent to one location and you're getting your money as direct deposit, and you're going to be living in another house in the United States, you're not leaving the country, and you're going to be gone, you're going down to Arizona for 2 to 6 months. Uh, no, that's not required to be paid or not required to report to us, but you better be sure we could send you something or we could contact you. So you want to be sure that you are having your mail reviewed and reported to you. That for our purposes, it doesn't matter where you're living in the United States. But remember, if we send you something in the mail and let's say you're on disability, for example, and we're asking you, you have to do a medical review and you don't respond to us, your benefits are going to get cut. And you can't say, oh, well, you were sending it to the wrong place. Well, you never told us where you were living, so we sent it to the address we had on file. So there's no requirements that you report it to us if you're receiving Social Security benefits. If you're on SSI, our needs-based benefits, you are required to report any change in address.
Okay, and then there was a comment bouncing back to Social Security and possible changes in 2034. A comment, wouldn't that be considered theft?
No, we paid all the benefits out, and we'll still can be condemned. So it's not like we kept the money. We brought the money out, and Social Security's mission is to pay benefits out to people, and we would have paid all the benefits out to the people. So no, and you will get money back. We're not saying you're not going to get any money back. You just won't get as much money back as was initially projected. So, even if you cut the benefits by 20%, you're still getting 80% of your money. Is that a great situation? No, absolutely not. But you're not, and most people that are receiving benefits that are on retirement benefits, for example, generally every dollar you paid in individually, you will withdraw within roughly about 7 years. Even so, at the 80% level, you'll be drawing everything out maybe in 9 years. And that's part of the reason that we're running out of money, is that we are living much, much, much longer than we used to compared to where the life expectancy for a 65-year-old person was in 1940 compared to where it is today. It's almost doubled. That 65-year-old person is living twice as long as they used to. So no, it's not theft. We're still paying out all the money, and we would continue to be paying out all the money. So it's just that we wouldn't be able to pay out as much. And so we have the authority to go ahead and reduce benefits in order to keep the program going.
Okay, and I do not think there are any questions at this time.
Okay, so let's go ahead and roll on. I want to go backwards real quick. There's one very important thing I want to touch on, which was the rules for recent work. I briefly touched on this. If you're filing for our Social Security disability insurance, you're required to have recent work in order to qualify for benefits. As I'd indicated, if you're 31 or older, basically we're going to look backwards 10 years from when you say you became disabled, and in that 10-year period, you have to have the equivalent of 5 years where you worked and paid into Social Security. Once again, we're not looking at a lot of work. That's roughly $8,000. So if we look backwards the last 10 years from the date that you became disabled, and you had some years where you had zero and some years where you had $8,000, as long as you have 5 years where you had the equivalent of $8,000, you could go ahead and file for benefits. As we go backwards and making you younger, we look at less and less time, all the way down to if you're in or before the quarter you turn 24. So if you're 24 or younger, we're only going to look basically at a year and a half work during the last 3 years of your history before becoming disabled. So the thing I just like to point out here, younger workers, we don't look at the last 10 years, we can scale that back. Okay, coming back forward to our needs-based SSI program. A couple of things that I'd skipped over, I just want to remind people about. SSI, the needs-based program. We're looking at, do you have limited income and few resources? Are you age 65 or older? Are you totally or partially blind? Or do you have a medical condition that keeps you from working and is expected to last 1 year or result in death? Going back to that medical definition that we had. If you're in that situation, you potentially can qualify for SSI or needs-based program. There are different rules for children, and I'll touch on those shortly. When we're looking at the SSI program, remember, we're going to look at your income, and we talked about what income was. We're going to look at your resources, and we talked about resources. But also, we're going to look at where you live. You do need to live in the U.S., the Northern Mariana Islands, or one of our territories. If you're not a U.S. citizen, but you're lawfully residing in the United States, you still may be able to get SSI. Most of the times, SSI, our needs-based program, are for U.S. citizens. If you're non-citizens, there are some possibilities to where you could potentially qualify for benefits, but there are a number of hurdles that you need to overcome. I'm not going to be able to go into all those today. There are a number of different things that we need to establish to see if a non-citizen can qualify for our needs-based SSI program. Okay, covered that. Living arrangements. Of course, when you're filing for SSI, we want to know about living arrangements. Where are you living and who are you living with? Basically, we're trying to determine, are you getting any type of rental or a living allowance subsidies? Is someone paying for your living expenses? So if you're living in someone else's household, if you're living in an institution, if it's a board and care facility, these are all things that we need to know. And if you're living in someone else's household, if someone moves into the household, if someone moves out of the household, we need to know all that information. There are lots of reporting responsibilities if you're on SSI, our needs-based program. Okay, SSI for children. I want to touch on this real quick. A disabled person who is neither married nor head of household and is under the age of 18 or is under age 22 and is a student regularly attending school. Those can be considered to be children for the purposes of our SSI determination. If under age 18, the child has a physical or mental impairment or a combination of those conditions that results in a marked or severe limitation in functioning. So this is a change in how we look at adults for disabled. We look at, if you're an adult, 18 or older, we look at your ability to work. How much are you able to make a certain amount? For a child, we don't look at the child's ability to work. We look at, do they have a marked and severe limitation in functioning? If you are a child and you're on the SSI program, this also means, of course, that we're going to be looking at the income and assets of your parents. But let's say you are on the SSI program. When you reach age 18, we now reevaluate your case. We're not looking at your marked or severe limitations in functioning. We're going to look at your ability to work. And many children that are on this, because of this definition of disabled as a child, at age 18, they lose their benefits. Because when we look at the definition of work, they potentially would have the ability to return to go to some sort of work and make the $1,690. So there are many children that do come off the program and don't qualify as an adult because we changed that definition. And all children on the SSI program at age 18, we look at this change in definition and see if they can qualify or not. So disabled children living in a household with limited income and resources. So once again, if you're living with your parents, now then if you're in foster care, you're living with an aunt or uncle, a grandparent, we're not going to look at the household income. We're going to look at the individual child's income. But if you're living with one or both of your parents, we are going to go ahead and look at that income. If your parent is not in the household, though, but they are giving some sort of money to the household for your support, so child support, for example, Social Security auxiliary benefits because one of your parents is disabled or it's deceased or on retirement benefits, gifts, those monies are considered to be income for the child and can lower what the child gets from the SSI program. Talked about this already. Child turning age 18, we do the redetermination to see if they qualify for SSI continuing forward as an adult. And lastly, I just want to mention with SSI for children, we look at the concept of deeming. This concept is some of the money that your parents are making will potentially go to your support, and therefore you don't need as much money from SSI, the needs-based program. So with this, if your parent, one or both of your parents are working, that income can potentially lower how much SSI you get. This is a very difficult determination to make. We don't even try to do this on our own. When we go to make this determination, is the parent's income going to affect how much the child is getting? There are so many factors that can go into, is it going to lower it or not, that we usually feed it into the computer to figure it out. Because it changes depending on the number of children in the household, disabled or non-disabled, and the number of parents living in the household, and the nature of the income. Is it from work or is it from some other type of income? So there are a number of factors. So most of our workers couldn't even look at someone's income and say, well, I can tell you how much it's going to be lowered by. They're going to have to feed it into the computer to get the numbers to comp to help them understand. Now then, if you're looking at it and you have your parent is receiving $100,000 in wages, we can pretty probably clearly look at that and say, no, the child's not going to qualify for disability benefits under the SSI program. Yes, the child is 100% disabled, but they're not going to qualify because the parent's income is too high. Or the same thing with assets. We look at the parent's assets, and the family is allowed to have $5,000 in assets. If the parents are working, maybe they don't get enough work to qualify, but the parents have an IRA or a 401k with $50,000 in it. That becomes an asset and potentially would eliminate their eligibility for the needs-based program. Reporting responsibilities. As I indicated, there are lots of things to report for Social Security purposes. So if you're on our SSI needs-based program, these are all the reporting responsibilities you have. There are lots of them. I'm not going to go through each one of them today, but know that the person on SSI received this reporting responsibility list when they were approved for benefits. Hopefully they kept it, and hopefully they follow it. This is how overpayments occur. This is the leading cause of overpayments. There are a number of things you need to report when you're on this program, and if you don't report them timely, then an overpayment is going to occur. Want to just give you a little information. If you're working with someone that wants to return to work, if they're on Social Security disability insurance or they're on our SSI needs-based program and they want to return to work, there are a number of subsidies that will allow them to work and will not lower their Social Security disability insurance benefits or will not lower their SSI benefits. All these different programs can be found in the Red Book. You can go to our Social Security website, pull this up. So if you have someone that says, I'm on disability, I want to return to work, they should consult this Red Book. They may be able to return to work, and some or all of the money that they earn may not be counted, and they can continue to get their regular benefits and do the work activity. Just want to wrap up with a couple of things. Medicare and Medicaid, often the question is can you get one or both? Sometimes you can get one or the other, or sometimes you can get both. So Medicare, generally, if you are on the Social Security Disability Insurance Program, and you've been on that program for 24 consecutive months, you will automatically qualify for Medicare no matter what your age. If you're on the SSI program, generally, even if you're getting $1 from the SSI program, you will automatically qualify for Medicaid. Now, there are times where somebody on Medicare can also get assistance. Sometimes they'll be on Medicare and they can have Medicaid as well. There are times when you're on Medicare and the state will actually step in and pay for your monthly premiums for your Medicare Part B and Part D programs. That's the health insurance and drug portions of Medicare. The state will actually pay for those. If you want to learn more about what we've talked about today, I encourage you to visit our website, wealth of information there. And of course, you can sign up for your individualized My Social Security account. Hopefully you'll go ahead and do that. Just remember, if you need to get a Social Security card, if you have an online account, generally you can go ahead and get a replacement card. If you're making a change to the card, you'll need to complete that application online, and then you can schedule an appointment to go into the office to show your documents that you use to make that change. And of course, with Social Security, if you're unable to manage your benefits, we have a representative payee program. If you can't manage your benefits through here, you can obtain someone that will help you pay for manage the benefits. Usually it's a friend or relative, but there are agencies that also do this for you. Sometimes they do it at no charge. Sometimes there's a fee that you have to pay in order to have these agencies manage your benefits. All right. Are there any final questions for today?
There are. I have 5. Okay. So twice two people asked, are they going to get access to the slide deck?
Yes, I think I've already sent the slides. Not
Okay.
to all attendees, but I sent it to Anthony. I think I sent you the slides. Is that right?
You sure did. I just gave a thumbs up. Those will be sent in the post-webinar email.
Excellent.
Okay. Okay, a few more questions here. Can a spouse without a social security number receive the benefits from their deceased spouse? Question mark. And then outside the USA.
So we're talking about a non-citizen not lawfully admitted to the United States. While they're in the country, no. Unless they gain lawful status, they won't be able to receive survivor's benefits. And generally outside the United States, depending on what their citizenship is, no, they will not be able to get survivor's benefits. There are limitations on how long a non-citizen can receive spouse benefits, survivor's benefits, or children's benefits. But it depends on what country they go to. There's actually on our benefits outside the United States page section of our website, there's some information there that could give you a little bit more guide. Now, then, if you're the worker, you can take it almost any place in the world. Even if you did not earn the benefits here, having a Social Security number. I've had people that worked in this country for 20 years using somebody else's Social Security number. We moved that money. If they got lawful status, we'll move it to their correct Social Security number and allow them to qualify for benefits. Or if they're going to be living outside the United States, we'll still move that money onto another record and allow them to qualify for benefits outside the country. So when you work and pay into the Social Security system, the money is never lost. As long as you can remember what Social Security number you were using, if you gain lawful status, we'll move that money that you use somebody else's Social Security number to earn. We'll move that money to your record.
Okay. Next question. Affordable housing is a problem for people everywhere. When we talk about reducing the income for people who cannot work and there are no options for additional income, we are hurting our most vulnerable folks. Do you know if there is any discussion about eliminating Social Security retirement for people who have other income from retirement planning, etc.?
Yes, that has been one of the ideas proposed to go ahead and allow more money to stay in Social Security, they've actually looked at what they call means testing. And we actually already have a model in place to do this, generally affecting individuals that are over $109,000 in income in retirement, or over $218,000 as a married couple filing jointly. We already have a program that looks at that for other reasons. But yes, that could come into play. And based on those incomes, they could say, yes, we're going to lower or eliminate your Social Security benefits. That is one of the ideas that has been floated in order to not reach a date where we're going to have to cut benefits. There's a number of other ideas that have been floated as well. Encourage you to visit our website and look those up, or Google's just as good if you want to Google it and say plans to keep Social Security benefits at their levels. What ideas have been proposed? You can get up a nice little AI list of these different concepts.
Well, that's interesting, kind of scary. Next question. Can you talk about the 6-month period that Social Security uses as a waiting period? It used to be
Yeah.
the date a person was determined to be disabled was the date a person filed. Now there's this 6-month period that a person is not paid for once their case is finally approved. Why did Social Security do that?
Well, we've actually always had this. So number one, there's some, and it's not a 6-month period, it's a 5-month period. It's called the 5-month waiting period. So number one, this applies to Social Security disability benefits only. The SSI program, our needs-based program, you can automatically qualify for the benefit. If you say you became disabled as of July 1st and you file for benefits July 1st, you get approved, you get benefits July 1st. So that one does not have a waiting period. The SSI program does not have a waiting period, because the assumption is those individuals on that program have no other income and resources. Regular Social Security disability benefits, when the disability program was designed back in 1965, they added in this 5-month mandatory waiting period. So if I say I became disabled July 1st and we get approved showing I became disabled July 1st, my 5-month period is July, August, September, October, November. December would be the first month that I'd get paid or eligible to get paid. And we pay all our checks 1 month behind. So December's check arrives in January. That's how you got this 6-month concept, but it's really just 5 months. We pay all our checks 1 month behind generally. So yes, that 5-month waiting period has always been in existence for the disability program, and people have always objected to it. And I have to say, I've had clients that filed for disability and did not make it beyond the 5-month waiting period because of their severity of condition. So yes, now I can tell you the philosophical idea behind that. The concept is that somebody that is qualifying for Social Security disability insurance, they will have worked. And the concept is that somebody that is working should have 5 months worth of resources to live on, whether that's sick leave, vacation leave, money in an IRA, 401k, retirement plan, something else like that, money set aside in a bank account. They should have enough resources set aside to survive for 5 months. We all know that that's not true, but that's the philosophical reason behind that 5-month waiting period concept.
Okay, 2 questions. One question comment is in reference to the Social Security number. So someone who stole someone else's Social Security number isn't penalized?
That becomes a fine line. So if you're that, well, technically it's identity theft. It's not aggravated identity theft. It's not. We're not a law enforcement agency. We're simply an agency that tracks your ability to qualify for benefits. And so as long, now then there are times where if it's aggravated identity theft, where you opened up bank accounts and you stole money from the person and you forged credit cards. Potentially, if the person's been prosecuted, then we can go ahead and not combine it. But if there's no legal action like that, yeah, we'll move the money to the good record and allow you to qualify for benefits. We're not a law enforcement agency. We're an agency that likes to give people money.
Okay, last question. One of my clients has been waiting for approval and has signed consents for Social Security to get her records from all of her providers. She just got a denial, and on the letter, it lists what information was used to make the decision. But they aren't showing the most important information for her physical impairments. She signed everything, and we don't understand why Social Security doesn't have that info. Any
Simple explanation.
suggestions?
Yeah, and it happens all the time. Simple explanation. Your doctors didn't return the information to us. We can't force a doctor to send us anything. We can send in that form saying your client said that you're to return over your medical records. Depending on how old those medical records are, or if there was enough information, or if the doctor got that permission slip, they will or will not turn over the information. There's nothing compelling them to do that. And since we're not paying them to do that, it's only at their cost. If maybe they didn't want to make photocopies and mail it to us. There's a number of different reasons, and I've seen that happen not once, but a number of times. So this is what you want to do. File the appeal, get the medical records from that provider and attach it to the appeal. If you simply say, get this medical record, we tried the first time and they didn't send it to us. What do you think the odds are that they'll send it to us the second time? Maybe they would, maybe they won't. The way you can cut out the middleman, file the appeal, get the medical records yourself. Go to that provider. Go to that provider every day and asked for those medical records. They should be able to give them to you. If you're there in front of them, it's more likely that they'll get them to you than you simply saying on your appeal you didn't get the most important thing. We tried, we just didn't get it, and I've seen it happen before.
Someone put in the chat, the lawyer can subpoena the medical info.
Sure. But you don't want it to go to the third level, because after you're denied the first time, it goes to the reconsideration level. And that's going to take another 6 months generally. So if you're denied the first time, you file a reconsideration. It goes back to our doctors. A second group of doctors look at what the original doctors did. They look at the exact same information the original doctors did. They're going to come up with the same conclusion. So if you're denied the first time, you still want to get those medical records and you want to get them to us, because the first group of doctors didn't have those records to evaluate. You could get approved at the second level because of new and material evidence. If you get denied there, then yeah, your attorney can subpoena the records for you at the third level, because now it's a legal case. But now you're looking at another year down the line. So better to get the records yourself if you possibly can.
Okay. And then a comment came in saying immigrants with their pension with SSA can set up their spouse in Mexico to receive survivor benefits, no Social Security on their own, and living in Mexico.
I'm sorry, is there a question?
Yeah, it's a comment in the chat. Immigrants with their pension with SSA can set up their spouse in Mexico to receive survivor benefits, no Social Security on their own, and living in Mexico.
So if they're a non-citizen and they're in Mexico, and the spouse passes away, this non-citizen spouse in Mexico requests to receive survivor's benefits. They can receive them for a limited amount of time, and then the benefits would be terminated. Generally, I believe it's 6 months after being outside the country. So if this person is not a U.S. citizen, they don't have legal status here in this country, they're a survivor outside the country, they request survivor's benefits, Theoretically, their benefits should be either denied or they would be terminated eventually. So generally, that is not supposed to happen. Now then, someone can lie to us. They can say maybe they have legal status and maybe they say that they're actually living in the United States, but they've moved out of the country years ago. It's happened. It's hard to track, but generally they should not be receiving the benefits. Were there any other questions?
I don't see anything else coming in. I hope that I was able to relay everything.
Okay, well, this has
Okay.
been great. Some good questions. I like questions when they come in. It shows that you're an interested and involved audience. So I do appreciate that. Any other final thoughts before we wrap up today? I'll just say this. Remember, please set up your individualized My Social Security account. Best way to get information about Social Security is by having those online accounts. Any other questions come in?
Nothing so far.
All right, then I think we're all set. Maybe go out and get an early lunch or something. Thank you so much for attending and asking the questions. Hopefully this was beneficial to you and you'll walk away with a better knowledge of this program. If you would like to have a presentation about our other general programs, retirement benefits, survivor's benefits, a little bit more on Medicare, spousal benefits, please send it to DSHS asking for that type of presentation. I'd love to come back and talk about our other non-disability programs. All right. Well, thank you so much, everybody. I'm going to sign off. And hopefully you will have me back to do our general presentation.
I think that you can consider that a done deal. We really appreciate your time today, Kirk, and thank you. And thank you, everyone, for sticking around and for participating and for all the questions and interactions. Everybody have a great rest of your day, and we'll see you for our next webinar in August.
Thank you.
Thank you all. Bye now.
Bye-bye.